6:47 in the morning. The break room sits nearly empty. One nurse in the corner, eating rice from a small container. Quiet, invisible, exactly where she wants to be. The door swings open. Dr. Whitmore walks in with 3 residents behind him. His eyes scan the room and stop. He points directly at her. "You, Margaret." The container freezes halfway to her mouth. "Emergency trauma drill. 10 minutes. You're demonstrating chest tube insertion." He doesn't wait for her response. In front of everyone, through the glass wall, the trauma bay is already filling. Nurses, residents, attending physicians checking their watches. 20 faces, 30, all waiting for something. Whitmore turns to his residents. His voice drops just enough to carry. "This should be educational." One resident smirks. Another looks away. Margaret sets down the container. Her hands don't shake. They don't tremble. They just stop, completely still, unnaturally still. She stands slowly, says nothing. Whitmore watches her with the kind of patience a man has when he already knows the ending. She walks toward the trauma bay doors, each step measured, unhurried. The crowd behind the glass grows quiet. Her hand reaches for the door handle. Fingers wrap around cold metal. She doesn't push it open. Not yet. The trauma bay is packed with 23 people. Nurses, residents, and attending physicians, all gathered around a simulation mannequin. It is 6:57 a.m., the fluorescent lights casting a sterile glow over the tense scene. Dr. Whitmore, in a crisp white coat, steps forward with a thoracostomy kit in his hand. His voice is steady, clinical, cutting through the low hum of the room. "Margaret," he says, pointing directly at her, "your charting has been consistently slow. Your vital checks hesitant. And you never participate in rounds." A ripple of reaction moves through the crowd. 2 residents exchange smirks. One lets out a soft, dismissive chuckle. At the back, a nurse shifts uncomfortably, crossing her arms tightly. Another nurse looks down, avoiding eye contact with anyone. No one steps forward to defend her. Whitmore doesn't wait. He holds up the kit, its instruments glinting under the harsh lights. "Today, you will demonstrate the full chest tube insertion procedure," he states. "Verbal callouts at every step. And we are timing you." He gestures to the digital timer mounted on the wall, its display flashing 4 o'clock. "Average residents complete this in 3 minutes. Let's see how our quiet nurse performs." The room holds its breath. Then his tone lowers, aimed not at Margaret but at the audience. "And given your background, perhaps you've had practical experience." The words hang in the air. A sharp gasp escapes 2 nurses simultaneously. A resident stifles a nervous laugh, clapping a hand over his mouth. Whitmore's expression doesn't change. No anger, no satisfaction, just the same detached professionalism. Margaret stands frozen for a heartbeat. Then, slowly, deliberately, she takes the kit from Whitmore's outstretched hand. Her fingers close around the tools with precise control, but her gaze never wavers from the mannequin. She begins arranging the instruments on the tray. Scalpel, forceps, chest tube, suture. Each movement is methodical, efficient, but her eyes stay fixed on the task. No glance at the crowd. No acknowledgement of the stares. Whitmore watches, his lips pressed into a thin line, analyzing. The tension is palpable. Then click. The timer's button is pressed. A sharp digital beep echoes through the room, followed by the relentless ticking of the countdown. 4 minutes, he states flatly. Begin when ready. Margaret's hands pause for a fraction of a second. But she doesn't look up, doesn't speak. The digital numbers flicker. 03:59, 03:58. The crowd leans forward, some holding their breath. The only sounds are the timer and the faint rustle of Margaret's movements. Her face remains unreadable, a mask of calm. The question burns in the air. Will she attempt it or refuse? The room waits, but the only response is the steady tick of the clock, each second amplifying the pressure. The simulation mannequin's artificial breath slow, a reminder of the stakes. Margaret's hands move first. Scalpel, clamp, tube, suture. Each instrument lifted from the kit and placed on the sterile tray. The layout is textbook perfect. Spacing exact. Orientation precise. She never looks down at the instruments. Not once. Whitmore watches from 3 feet away. His arms are crossed. His smirk is gone. He expected fumbling, hesitation, dropped tools and shaking fingers. Instead, he sees something else. Her hands glide through the setup like she's done it 1,000 times. Muscle memory. Automatic. The kind of movement that doesn't require thought. He clears his throat. Any time now. Margaret doesn't acknowledge him. She picks up the scalpel. Positions it against the mannequin's left side. 4th intercostal space. Mid-axillary line. The angle is exact. Whitmore steps closer. His frown deepens. The incision is clean. One motion. No hesitation. A resident leans toward another. His whisper barely audible. She's actually doing it. Whitmore's head snaps toward them. Then back to Margaret. His voice cuts through the silence. Verbal callouts, nurse. Protocol requires verbal callouts. Margaret pauses. Her hands hover over the mannequin. She doesn't look up. Incision complete. Her voice is flat. No inflection. No emotion. Dissecting through subcutaneous tissue. Whitmore's jaw tightens. Louder. Everyone needs to hear you. She continues at the same volume. Same flat tone. As if she didn't hear him at all. Her hands never stop moving. The dissection continues. Layer by layer. Controlled. Methodical. The timer on the wall flashes. 1:47. Whitmore says nothing. His frown has turned into something else. Confusion. Maybe concern. He watches her hands. Really watches them now. At the back of the room, 2 nurses exchange glances. One mouths 3 words to the other. Where did she learn that? No answer comes. Margaret doesn't look up. Doesn't smile. Doesn't show anything. Just keeps working. The timer ticks down. 1:42. 1:41. 1:40. The room holds its breath. The timer flashes. 2:34. Margaret's tube hovers at the insertion point. Her fingers hold it steady. Perfectly aligned. She doesn't move. Whitmore steps directly beside her. Close enough that his shadow falls across the mannequin. He turns to the crowd, voice rising for everyone to hear. Notice the hesitation before insertion. He gestures toward her frozen hands. This is typical of undertrained staff. Freezing at the critical moment. But Margaret isn't hesitating. She's checking tube position. Angle. Depth. Entry trajectory. Her eyes scan the insertion site one final time. Then she moves. One smooth motion. The tube slides through the incision. Into the pleural space. Perfectly placed. A sharp hiss escapes the mannequin. Simulated air rushing out. The sound of a correctly decompressed pneumothorax. Someone in the crowd murmurs. Another voice. Louder. Clean. Whitmore's expression doesn't change. He turns back to Margaret immediately. Sutures. Let's see if she can close. His tone has shifted. Less amusement. More clinical observation. Like he's watching something he didn't expect. Margaret reaches for the suture kit. Her hands work fast. Needle driver. Silk suture. First stitch placed. Then the second. Third. Fourth. The spacing is exact. Uniform. Each throw identical to the last. In the crowd, a surgical resident leans toward the person next to him. His voice barely a whisper. Those are military sutures. The other resident frowns. What? Nothing. He shakes his head. Just fast. Whitmore glances at the timer. 3:12. Margaret ties the final knot. Cuts the excess. Steps back from the mannequin. Silence fills the trauma bay. 23 people. No one speaks. Whitmore moves forward. He examines the sutures closely. Runs his gloved finger along the incision line. Checks the tube placement. The closure tension. 5 seconds pass. 10. 15. The crowd waits. He straightens. His face reveals nothing. Adequate technique. His voice is flat. Passable timing. No acknowledgement of speed. No mention of precision. Nothing about beating the resident average. Margaret stands motionless. She doesn't react. Whitmore turns to the crowd. But in a real emergency, that hesitation at the start would cost a life. He pauses for effect. This is why we train. This is what barely competent looks like. Two nurses near the back shake their heads. One crosses her arms. Neither speaks. Margaret pulls off her gloves. Drops them in the waste bin. Silent. The timer on the wall blinks one final number. 3:24. No applause. No correction. No justice. Just silence. For hours later, the real trauma arrives. 34-year-old male. Motorcycle versus SUV. Penetrating chest wound. Blood pressure dropping fast. The trauma bay transforms. Whitmore leads. Residents scramble. Monitors scream warnings. Margaret is assigned circulating nurse. Her job? Hand instruments. Nothing else. The patient's vitals flash red. BP. 78/50 seconds. Heart rate. 134. Oxygen saturation falling. Tension pneumothorax. Left side. Whitmore announces. Chest tube. Now. A senior resident steps forward. His hands shake slightly as he positions the scalpel. The incision is rough. The tube placement takes too long. 15 seconds. 20. Margaret watches from her position. Her eyes move to the patient's neck. The veins are distended, bulging. She looks at the trachea. Deviated. Not left, right. She steps closer to the resident. Her voice is quiet, controlled. Check for bilateral tension. Possible cardiac tamponade. The resident doesn't look up, doesn't acknowledge her. Continues working on the left side. The monitor screams again. BP crashes. 62/40. Margaret's voice rises. Clear enough for the room to hear. Dr. Whitmore, there's a second tension pneumothorax. Right side. And possible pericardial involvement. Whitmore spins toward her. His face is tight. Controlled fury behind clinical composure. Nurse, do your job. Hand instruments. That's all. Margaret doesn't move. Doesn't reach for the instrument tray. If you don't decompress the right side in the next 60 seconds, he goes into PEA arrest. The room freezes. Every resident, every nurse, every pair of eyes locked on the confrontation. Whitmore's voice drops. Cold. Final. Are you giving me medical orders? Margaret meets his gaze. I'm telling you what I see. 3 seconds of silence. Get her out of my trauma bay. Security appears at the door. 2 officers. Margaret doesn't resist. She turns toward the exit. But as she passes the senior resident, she stops. Her voice is low, direct. Needle decompression. Right side. Now. Then echo for tamponade. The resident's eyes widen. He doesn't respond. Margaret walks out. The door closes behind her. She stands in the hallway, alone. Through the glass wall, she watches the chaos continue inside. The senior resident hesitates, looks at Whitmore, looks at the crashing monitor, looks at the patient's distended neck veins. Then he grabs a needle. Right side, second intercostal space, midclavicular line. Air rushes out. The monitor steadies. BP climbs. 74/48. Then 82/56. Then 94/60 seconds. The patient stabilizes. Margaret watches through the glass. Silent. No one looks at her. No one acknowledges what just happened. She was right, and she's still gone. 20 minutes later. HR office. Fluorescent lights buzzing overhead. Margaret sits across from a woman in a gray blazer. A stack of papers between them. Termination documents. The HR representative reads aloud. Her voice flat. Procedural. Insubordination. Practicing medicine without a license. Endangering patient safety. Margaret picks up the pen. Signs the first page. Then the second. The HR rep watches her. Waiting for protest. Argument. Tears. None come. You really told Dr. Whitmore he was wrong? In front of everyone. Margaret doesn't look up. The patient is alive. The HR rep leans back. That's not what the report says. Margaret's pen stops. Report says the resident identified the second pneumothorax. Dr. Whitmore approved the intervention. She taps the folder. Your name isn't mentioned. Margaret's expression doesn't change. Not anger. Not surprise. Nothing. She finishes signing. Sets the pen down. Stands. Am I done? The HR rep blinks. Security will escort you to the exit. You'll need to surrender your badge at the front desk. Margaret reaches for her badge. Unclips it from her scrubs. Then she hears it. Distant at first. A rhythmic thump. Growing louder. Closer. The windows begin to vibrate. Helicopter rotors. The HR rep turns toward the window. Her brow furrows. What the hell? Margaret doesn't turn. Her hand stays on the badge. Her body stays still. But something in her face shifts. Something viewers haven't seen before. Not confusion. Not surprise. Recognition. The rotors grow louder. The building trembles. She knows that sound. The Black Hawk touches down on the hospital helipad. Rotors still spinning. The noise shakes the windows 3 floors below. Seconds later, a security guard bursts into the HR office. Out of breath. Face pale. Military personnel at the main entrance. They have a critical patient. They're demanding immediate access. The HR rep stands. Tell them to go through emergency intake like everyone else. The door opens again. A Navy commander steps through. Full dress uniform. Silver oak leaves on his shoulders. Behind him, 2 armed operators in tactical gear. Weapons holstered but visible. The commander's eyes scan the room. They stop on Margaret. Lieutenant Commander Reyes. Margaret stands. Slow. Controlled. Commander Walsh. The HR rep's mouth opens. Closes. Opens again. I'm sorry. There must be some mistake. This is a nurse. She's being terminated. Commander Walsh doesn't look at her. His focus stays locked on Margaret. We have a Tier 1 operator. Experimental ordnance embedded in his cervical spine. Millimeters from the carotid. He pauses. No one else can do this. Margaret's jaw tightens. I'm not active. I left. You didn't leave. Walsh's voice is flat. Certain. You transferred to inactive reserve. You're still bound. He extends a folder toward her. She doesn't take it. Full surgical authority. Classified operation. Your hospital. Your call. The HR rep steps forward. Voice rising. She doesn't work here anymore. She was just fired. She has no privileges. Commander Walsh turns slowly. His gaze settles on her like a weight. She's not your employee. She's a Navy lieutenant commander with 17 confirmed saves in combat theater. He lets that land. This hospital exists because the Navy contracts with your trauma center. That contract is under my authority. The HR rep says nothing. Walsh turns back to Margaret. His voice drops. Chief Petty Officer Daniels. 29 years old. He pauses. You trained him. Margaret's expression shifts. Just barely. She takes the folder. Operating room. 1 hour later. The surgical theater is sterile white. Monitors glow green and amber. Chief Petty Officer Daniels lies intubated on the table. 29 years old. Unconscious. A metal fragment embedded in his neck. The imaging screens show it clearly. 3 centimeters from the carotid artery. Touching the C4 vertebral body. Any shift could sever the vessel. Any movement during transport could kill him. Margaret stands at the head of the table. Scrubbed in. Surgical lead. For the first time, viewers see her in authority. The door swings open. Dr. Whitmore enters. Still in his white coat. His eyes find Margaret. Confusion. Then anger. What the hell is happening? Commander Walsh steps between them. His voice is calm. Final. Classified operation. You're here to observe. Nothing else. Whitmore's mouth opens. Closes. He steps back. Silent. Margaret's hands move. Not nervous, careful. Not hesitant. Fast. Certain. Commanding. Scalpel. Her voice is the same flat tone. But now it carries weight. The scrub nurse hands it over. Margaret makes the incision. Clean. Precise. No wasted motion. Retractor. Vessel loop. The instruments arrive in her hand before she finishes speaking. The surgical team scrambles to keep pace. Whitmore watches from the corner. His face shifts. Anger fades. Confusion deepens. Then something else. Realization. Margaret's hands work through layers of tissue. Muscle. Fascia. Approaching the fragment. She narrates for the team. Each word clipped. Exact. Approaching fragment now. Vessel loop around carotid for control. She pauses. Nobody breathes for the next 40 seconds. The room freezes. Her fingers close around the fragment. Millimeter precision. She adjusts the angle. Pulls. One smooth motion. The fragment slides free. No blood. No arterial spray. No alarms. The monitors hold steady. Heart rate, 68. BP, 118/76. Oxygen sat, 98%. Margaret places the fragment into a metal tray. It's small, jagged, still warm. Get EOD in here. Now. Her voice doesn't change. That's a microdetonator. Body heat kept it stable. The room erupts. Controlled chaos. Nurses step back. Someone runs for the door. 2 minutes later, the explosive ordnance disposal team enters. Full protective gear. They examine the fragment under magnification. The lead tech looks up. His face pale. Confirmed. Thermally activated. If it had cooled during extraction. He doesn't finish. If she'd hesitated. If she'd nicked the artery. If the fragment had shifted even a millimeter. Detonation. Whitmore stands alone against the wall. Silent. His earlier words echo in the sterile air. That hesitation at the start would cost a life. He hesitated with the bilateral pneumothorax patient. Margaret didn't hesitate here. No one speaks. No one celebrates. Just silence. Post-surgery. The break room is empty except for 2 people. Commander Walsh sits across from Margaret. 2 cups of coffee on the table. Neither touched. Walsh's voice is quiet. 17 saves in Kandahar. He pauses. But you only remember the one you lost. Margaret doesn't respond. Her eyes stay on the table. That wasn't your fault. The ambush came before you could. He was 19. Silence fills the space between them. Walsh leans back. Daniels asked for you specifically. Wouldn't let anyone else touch him. He watches her face. Said you're the only one he'd trust with his life. Margaret looks up. Through the window, the recovery room is visible. Daniels lies still. Monitors beeping steadily. I didn't want to remember. Her voice is barely audible. That's why I came here. Walsh nods slowly. Sometimes they find you anyway. Margaret's eyes stay on the window. On the young man she just saved. Sometimes they do. Walsh stands. Leaves the coffee untouched. Walks to the door. He pauses at the threshold. Doesn't turn back. Welcome back, Lieutenant Commander. The door closes. Margaret sits alone. Hospital administrator's office. Next morning. 8:15 a.m. Dr. Whitmore sits in a chair across from the desk. Not standing. Not pacing. Seated. The administrator is a woman in her 50s. Gray hair pulled back. A thick folder rests in front of her. She opens it. 17 complaints in 18 months. Her voice is calm. Clinical. All dismissed. Whitmore shifts in his seat. I run an efficient trauma department. High standards require. You falsified yesterday's trauma report. Silence. The resident confirmed it. He stated that Nurse Reyes identified the bilateral pneumothorax. Not him. You altered the documentation. Whitmore's face changes. The confident authority drains away. The Navy has requested full incident documentation. They're conducting an independent review of your conduct. Whitmore stands abruptly. This is a witch hunt. Sit down. 2 words. Absolute authority. He sits. The administrator continues. Lieutenant Commander Reyes has been offered a permanent consulting position with this hospital. She will be training surgical residents for combat trauma scenarios. Whitmore's jaw tightens. She's a nurse. She's a naval special warfare combat medic with surgical certifications you don't have. The administrator closes the folder. Your privileges are suspended pending review. Security will escort you out. Whitmore says nothing. His hands grip the armrests. The administrator nods toward the door. 2 security officers enter. Through the window behind her desk, the training center is visible. Margaret stands at the front. 5 residents around a simulation table. Her hands demonstrate a procedure. Controlled. Precise. No longer hiding. A resident raises his hand. Asks a question. Margaret answers. Her voice still quiet, but clear now. Certain. No hesitation. Training center. End of day. The last resident files out. The door clicks shut. Margaret stands alone. She reaches into her bag. Pulls out an old Navy kit. The one she brought with her months ago. The one she kept hidden. Inside, a combat medic patch. Worn. Faded at the edges. She runs her thumb over the embroidered insignia. Looks up at the empty training room. On her desk, a note. Left by one of the residents. She reads it. Her expression softens. A slight smile. The first one viewers have seen. Margaret stands. Walks to the wall. Pins the patch above the training station. She steps back. Looks at it one final time. Then walks out. The lights stay on behind her.